Premature ejaculation is a common condition that affects an estimated 30% of men. By this fact alone, it makes this condition one of the most common forms of male sexual dysfunction. It's also very anxiety-provoking for men and very stressful. People have tried various processes or techniques, self-treatments, things such as slow intercourse or withdrawal or something called purposeful ejaculation or masturbation prior to actually having sexual intercourse. These processes sometimes work, but often are frustrating for patients, and so they often come in asking about other things that they can try. Things we talk about are techniques that can be done to improve the ability to sustain the sexual intercourse. There are a couple techniques that have been described, including the squeeze technique. What's involved here is after withdrawal from intercourse, the head of the penis is actually squeezed, and that will take away the urge or the desire for ejaculation. There's also something called the start-stop technique, and this technique requires coordination with your partner during the course of intercourse. It's important to recognize the signs that you're getting close to ejaculation, and before you reach that point, then you and your partner would stop, would wait for that urge to go away prior to resuming intercourse. This is called the start-stop technique, and it can work in some cases. As you can imagine, these types of problems can cause a lot of performance anxiety for men and stress related to that. So there are abundant relaxation techniques that you can also use, and these can be incorporated at the time of sexual activity. Things like massage therapy, relaxation techniques, creating the mood or atmosphere that is relaxing and not stressful. A lot of these types of interventions can often help to create a better experience for you and your partner. Now, when these things have been tried and are unsuccessful, then we can talk about other treatments that are available. There are various numbers of desensitizing creams, or what we call topical anesthetics, that you can purchase at your local pharmacy that can be applied to the head of the penis to decrease the sensitivity to that area. These can have certain side effects, like it can decrease the sensual pleasure for both you and your partner in some cases. As a last resort, or kind of more aggressive medical therapy can be pursued, and these medical therapies involve the use of a class of medications called SSRIs. This stands for selective serotonin reuptake inhibitors. This is a class of medications that include antidepressant medications such as Paxil, Prozac, and what these medications do is that they increase the levels of serotonin in your body. One of the side effects of these medications is to allow you to be able to go longer, decreases sensitivity during sexual activity, and can improve the problem of premature ejaculation. However, you have to be committed to taking these medications regularly. You also have to be aware that these medications may have certain side effects, and so it's important to talk to your physician about these potential side effects before starting some of these medical therapies.